Informatics is the study of people, processes, technology needed to make good use of information. Most fields these days are information-driven, including public health.
Informatics is fundamental to public health. It's all about taking information and applying it in the best way we can, driving public health's goal of improving the health and well-being of individuals.
Public health informatics is critical to the Regenstrief Institute, and it's a key part of how we're supporting population health here in Indiana and around the world.
The Regenstrief Institute is an applied research institute based in Indianapolis, Indiana, affiliated with the Indiana University. It's about 50 years old now. It was started in 1969 by Sam and Murdy Regenstrief with the goal of establishing an institute that was going to focus on how do we best use information and technology and capabilities to create a more efficient and effective health system. We realized early on if we could develop new approaches to be able to transform the way that people interact with information and have it at the right place at the right time to make the right decision, we were going to be able to fundamentally change and improve health and healthcare.
We start with the principle that tomorrow we are not going to have less data, we are going to have more. And so we need tools that allow us to very quickly and accurately cut through the noise to get to the information that's needed and necessary for the problem at hand.
Newer tools and techniques like machine learning and artificial intelligence are really crucial for the future of public health. We believe that they can be used to inform in near real time the work that public health is doing.
Machine learning solutions can help us look at the patient's background, the patient's history, and a myriad of other data sources and help providers and health workers make informed decisions on who is at greater risk and who needs care. Upstroms is an example of a very strong and valuable machine learning solution that came out of our group.
We sat down with the community partners and said, what are the challenges you're having? Where can we help? And across the board we heard social determinants, social factors, social risks. We know they're important, but we just don't know how to effectively and efficiently use our resources to address them. Upstroms is Swedish for upstream. Those challenges that individuals have, they manifest in poor health. So let's not try to address them when they become problems. Let's look upstream and address them beforehand. We've built very large machine learning applications to really inform a referral to a provider who can deal with those challenges, whether they are behavioral health, a social worker, maybe a dietitian.
Fundamentally, we are a research and innovation organization. To establish the value, the effectiveness of your research, you have to study it, you have to assess it. If you don't keep in mind how data and technology supports the human effort, the human need, the human priorities, these systems will fail.
We know for a fact that many AI tools have shown significant biases. In our efforts, we ensure that the models are bias-free by rigorously investigating the data and practices that go into each machine learning model, and then also investigating the finalized machine learning model to look at how they perform across different patient populations.
COVID-19 really hit our state fast and hard at the beginning of 2020. Once we realized that the number of cases in Indiana were going up sharply, we quickly put together a system that would visualize the information for our public health partners. Our public health partners, particularly at the county level, have been able to use our information to understand the impact of COVID-19 on African Americans, on Latinx communities, and on other marginalized populations to support those communities in the time of COVID-19.
We've worked with the Regenstrief Institute for the 17 years that I've been director at the health department, and even before that. Since the start of the COVID outbreak, the Regenstrief Institute's been a tremendous support. They've provided information to all the counties in the state through their dashboard. And more than just creating that dashboard, they meet with us weekly to improve it. Research is really essential to understanding what works and what doesn't. It's kind of what we do day to day, but in a more formal and thorough manner. In our partnership with Regenstrief, we've been really successful in shaping the research questions and the methods in ways that make the results really practically applicable, something that we can use immediately and use to improve our day-to-day operations.
The impact of the Regenstrief Institute extends well beyond Indiana and even the United States. Our work has affected people all over the globe, whether it's the work in data standards, helping nations establish health information exchanges, and otherwise improve their capabilities for public health. Building on our incredible past 50 years of innovation, we're looking at significant investments and improvements in artificial intelligence, in machine learning capabilities, natural language processing. Not only continuing to work with our health system partners and public health agencies, but also increasingly with people to be able to put the right information in the right people's hands so that they can improve their own health and we can create a healthier world.